We sure are. Thank you, Matthew. I'd like to invite all of our panelists to turn on their videos and get ready for a rousing roundtable discussion. And then we're good to go. Matthew, I'll turn it over to you.
All right. So what we decided to do on this, again, we're trying something new with this. This is a peer-to-peer event. And as such, we really want you to share your ideas with us. We'll be happy to share those out as you chat them into us. But we also want to share some new thoughts with you, some things that we want you to consider. And so this is your chance to ask any of the panelists to discuss any of the topics that we've talked about, any of their individual presentations, or ask them to round robin topics that might be interesting to the group. So if you have those, please continue to use the question and answer pod. We are monitoring the chat pod as well, but it's easier for us if you can post those questions into the question and answer so that we can ask those in real time. So there are a few questions there that have come in from various individuals, so we'll try and direct these the best that we can. I'm going to throw this one, I think, to several on the group. So what is the process or system of measurement on the cost related to quality of life issues on the rising rate of sexual assault cases in one community? So I think that kind of that question gets at the essence of quality of life issues versus, what's the cost to society, all those things that are being considered. So maybe Paul, if you're available, we'll start there and then we'll just let the panelists pick it up.
Hey, Paul, can I add a comment before you start?
Please do.
If I had Paul's research before I started having these conversations, it would have made my life a lot easier.
I just would have made your life more complicated, Bruce.
He published them after I had a lot of these dialogues. And it kind of killed me when he published them. I go, man, I wish I had had this 2 years ago when I started this, but I'm sorry to take your thunder.
No, that's great. Bruce, my goal in life is to complicate yours as much as possible. The quality issues are really interesting. So if you're not familiar with this on equality, a part of this is how do you begin to translate things that are difficult to measure to dollar forms that can be compared. And I know for folks that are not on my side of things, this sometimes is a very troubling thing to be able to say, well, okay, somebody was in a car accident and lost a finger. And I'm going to tell you what that's worth, in terms of the quality of life. But it's the idea of equality and working this through was to try to take it away from some of the dollar figures that we would have to just say, okay, well, it's affected your life in this metric. So when you look at this for qualities globally, not just sexual assault, but globally, there are metrics there that say, okay, well, what age are you? When did this happen? What was it that happened to you? And to be able to translate that into something in terms of quality years lost. So it's, as I said, it's not specific to sexual assault. It's to anything that could possibly happen to somebody. And so we use qualities as a metric. Let's suppose something happens in childbirth, and a child's airflow is cut off and it affects their mental development. We can measure what that has done in terms of years. So it's a health economist way to be able to do things. Now, using the statistical approach and largely, the Aldi and Viscusi metrics on this is it's a translation to dollars and it's a minimum. So a lot of what we do as economists is we're going to measure things in terms of earnings lost. And so it's just like, this is the low number on this in terms of what the effects are going to be. So the question that comes in specifically to sexual assault and what it does to an area, I haven't really seen something that takes it completely through. Generally, it tends to be applied to a single case. So if you had a court case, for example, and you were trying to assess what the damages are, we would look to that specific individual and what happened to them. And I say this, I don't want to get too emotional when I talk about these kinds of things, because, you know, personal experience of people that you know and love enters into this. I mean, you can't help but think about the damage to, you know, through PTSD, or people you've watched what they have suffered on this. And it's a very individual thing, but it can be measured. And this is what underlies the economist's role in a lot of court cases, to be able to say, okay, well, this is what this means on this diagnosis from whatever your health professional is, whether it's, you know, physical, mental health issues, all of these things that you have. It's a way to be able to translate that over. So I love the question, but we've not had something that's looked so specifically to say, well, here's the general things that we have. So I think, you know, Rebecca Campbell's work that she was showing you on how they did that, it would be a study such as that to be able to say, okay, here's the community-based thing. Let's deal with the probabilities of all of the things that are involved with that. So you know, I'm always fascinated whenever she speaks, because I just, you know, I appreciate both the statistical work, but the breadth of what she's looking at here. And I think the conversion of qualities to either as the metric or to dollars on this would take a study such as the one that she undertook with respect to Detroit. So that's a long answer to a great question. I'm sorry.
That's great. Great question. Great answer. Let's transition to Julie. Julie, you're posting some things in the chat. Your thoughts?
Well, individual states have looked at the impact, financial impact on their state. I think Minnesota was the first state to do this. In Utah, it was our state health department that looked at this data and published this in 2016. And if you do cost of sexual violence, Utah, Google that, the form will come up, and they followed similar protocol of what other states have done. And we found that it's $4.9 billion sexual violence costs our state per year. So that works out to be $1,700 per year per Utah resident. The bulk of that was for adult cases, adolescent adult cases, for $4 billion, and the $900,000 was the estimated cost per year for child sexual abuse. So it costs all of us, right? It costs all of us.
And Lisa, let's toss it to you on that same question.
Lisa, you're muted.
The CDC published an article in the American Journal of Public Health, I think in 2017, where they attempted to do this for sexual assault. And they used 14 different categories, and they estimated it based on not reported numbers of sexual assaults, but on the prevalence numbers that you see in like the the National Sexual Violence Survey. And so theirs worked out to be like $122,000 per victim over the lifetime.
Lisa, did that feel low to you?
Yeah, absolutely. Yeah. I think you can only see that as a minimum.
So I want to just pause here for a second. We've got another contributor, one of our NIJ team, that's able to join us now via phone. So Tracy Johnson is on the phone with us. Tracy, we wanted to go to you with some clarification on eligibility of rapid DNA samples, and a little bit of clarification, and also some thoughts on what NIJ is doing in this space. Are you able to hear us?
I can, Matthew. Can you hear me?
Yes.
Fantastic. Yeah, no, thanks for the opportunity to provide a little bit of clarity. So I don't want to be a naysayer for the Rapid platform, because it's a fantastic platform. But right now, it's really just not configured in a way that's amenable to crime scene samples, including sexual assault samples, because of the limited template, potential for mixtures, as well as other factors. It's really a swab in, profile out platform that's intended for, right now, reference samples. And so processing of reference samples, they are eligible for CODIS. Now, all that said, there are some guidance from the FBI on using the RAPID platform for non-CODIS samples. And that's on the FBI's RAPID site. It's called the Non-CODIS Rapid DNA Considerations and Best Practices for Law Enforcement. So that it is a possibility to use that platform for those types of samples. You just need to do that with those considerations in-house. And there are a lot of examples, or there are some examples of agencies that are doing that. They're using these platforms for those types of samples. Salem in Pennsylvania comes to mind as one of those, with Fred Horan and his work. But what I'm here to really kind of tell everybody is that I have some, kind of exciting information, and that those platforms right now, both the Andy and the Thermo platform, are being modified by each of the manufacturers to incorporate additional capabilities, as well as some expert system capabilities to be able to handle samples that are crime scene samples. And so that is the work that NIJ is funding. So we're funding the FBI to evaluate these modifications and these enhancements. And so those enhanced platforms are not going to be available to be tested until probably the summer or fall. But after that point in time, there will be testing done. And the results of that testing that the FBI is going to be doing, that the NIJ is funding, should be available. I think that the period of performance is 24 months. So the start time is unclear right now, just because the manufacturers are working towards those new enhancements. But once that testing starts, and there is an intention to publish these results as well. So the future looks bright for that particular type of platform. I just want to, throw out a word of caution. If you're considering those for your state or agency, to do so with these sort of best practices in mind. So really appreciate the opportunity to respond to that, Matthew.
We appreciate the update. That's exciting information. Just to clarify for the audience, then, most of the entities, Arizona, Kentucky, to name a few, are using more of a 1-2 swab approach. They're evaluating a swab with the rapid, and then proceeding with another technology with a more traditional DNA technology that's used in the laboratory to get those samples into CODIS. Is that correct?
Absolutely, yes. And that is a very common approach, to use an A/B swab sort of method, so that you have the A swab that's processed through the rapid instrument. And it gives you that very quick result, as Dr. Speaker discussed. But then the B swab is used to actually have that profile also uploaded into CODIS, which is important nationally to have those profiles available. Yes, you're correct.
Thanks, Tracy. We really appreciate you joining us and your contributions to us. That's really important clarifications. I want to transition to our nursing. Thanks again. I want to transition to our nursing team now. One of the questions that came in was talking about the sexual assault kit paperwork, and if it's included in the sexual assault kit, is it considered a medical record? Deb, maybe kick that off, and then let's maybe roll that over to Julie.
Okay, and I talk about what we do here, obviously in Idaho. We don't have a standardized electronic form for the state. We do have a standardized form that comes in the sexual assault examination kit. It's filled out, it's a one-pager that's filled out by the SANE at the time of the exam, and that goes back into the kit. The medical forensic record is a totally separate thing that is created by each organization and has all of the healthcare information in that. There's been some initial conversations beginning in Idaho about our medical forensic record. We kind of referenced that yesterday, that I had a law enforcement jurisdiction call me and tell me that we had one of our patients who had sent in an anonymous kit wanted an investigation opened after 12 years. And unfortunately, in accordance with Idaho statute, her medical record had been destroyed after 10. And so that has begun a conversation we're having to really define what that medical forensic record looks like. And I would anticipate that having some talk around that then about would that be, can we go to an electronic standardized form? And maybe the conversation also needs to go, can that go directly to the lab, the entire record electronically? So we're at the very, very, very beginnings in Idaho of trying to figure that out.
Julie, what are you seeing nationally?
Nationally, these records absolutely are medical records. The International Association of Forensic Nurses, victim advocacy groups, and it's really important that we are very clear that these are medical records, because that means that they are under HIPAA. And because they are under HIPAA as being medical records, the patient or victim needs to sign a release form granting that we can release these records to the crime lab, law enforcement, the prosecutor's office. So because they are acknowledged as medical records does not mean that we don't share them, but what it means is that we have the patient complete a HIPAA authorization form. I think that having the full record for the forensic scientist, similar to what I shared about meaningful data that can be extracted for both investigation, prosecution, forensic analysts, comes from these examination forms. And so I think it is best if the partners have these forms for those patients that sign over that HIPAA consent form. We really have a dangerous situation if we do not say that they are medical forms. And Bruce, alluded to this in his, is the confidentiality, because not only are these related to a criminal case, but being medical records, they have a heightened level of privacy concerns. And so we have to have a victim sign a HIPAA authorization release.
I think that's a really important point, Julie. And I think that we have to recognize this is a dual record, that this is a medical record and it has to stay intact with all the protections around that. That we have to figure out, how do we pull out the forensic piece and get that information where it needs to go.
Bruce, do you have thoughts there?
Well, yeah, I agree with everything everybody's saying. And, I talked about encryption, when it's transferred. I talked about encryption when it's stored. If you don't have the ability to pull the data out of the form, like you might with a handwritten form, what you're left with is, just transferring the form to the lab and from the nurses. And you can, of course, read the form, but the nurses then are obligated to type in the critical pieces of information you need, like the law enforcement case number, if you need the name of the victim, for example. So they've got to replicate some of that information they've already handwritten into the form, right? You're trying to avoid that. And I understand handwritten forms were the norm, and they were for us in California up to just a few years ago. So if there was one thing I would recommend people working on first, would be to standardize this form, make it electronic, and make sure you can get the data out of that form in text format so that it can be handled by data systems. Once you've done that, then it just is a matter of details about who implements things and moves it around.
I want to talk more about the culture change here. So when we initially, at least in Idaho, started having these discussions about 2014, we had a lot of discussion about the kits being tested rapidly, mainly for the speed of the investigation, for the speed that the court needed to prosecute things. All these things were considerations for the laboratory. And then there was a cultural change to, well, we need to test these kits because there might be other things, there might be other crimes out there. And I love the presentation today from Dr. Campbell. I wish she was here with us to answer a few questions, but I'm interested in the panel dialoguing on this this length of the testing window, and that I see as a new culture change, kind of a paradigm shift into how we're looking at these kits and the processing time. So Bruce, do you want to kick that off? Thoughts on that, that presentation?
There's both a good thing and a bad thing. I mean, the mandates add a sense of urgency to this, and it streamlines your dialogues, because, okay, we're going to have to do this now. It becomes how, not if, right? So that's important. But you don't want to compromise how these kits are looked at. And when you try to be too efficient, you're going to have to start cutting corners. So there are some labs in the country that will actually maybe just do 3 swabs and then stop. Now, fortunately, if they don't find anything, they'll go back and look at the other swabs too. But that type of methodology is something we've rejected. And what our sexual assault examiners really want to do is take every case differently, look at it differently, be able to have the freedom that they need to choose the right swab based on the circumstances of the case. That critical examination of the case is very, very important. So with that in mind, you can't necessarily script this like an assembly line. I mean, these are very complicated cases. They're not, like I said, doing a cholesterol test at a clinical lab, right? So by mandating a certain amount of turnaround time, economies of scale, resources availability, and all that kind of stuff is a separate conversation, but you still don't want to dictate a reduction in quality and appropriateness in these cases, because doing a case the right way is far more important than getting it out in 120 days.
Other panelists want to weigh in on that question?
I think that that's kind of part of the work that they were doing out of that San Francisco lab, is to say, well, you know, how do you get this? And I've had this conversation with my wife, who is a sexual assault nurse examiner, and kind of talking about, as she puts all of her notes down and everything that's dictated to her that she puts in there, to realize how much of somebody that she is, you know, taking care of, and how the entire timeline and the immediacy of everything that they're telling her may not be the best indication of this is the best sample to begin with. And I think this is where the Stanford folks' work was really, really important when they looked at this in San Francisco, because it's like, yes, we heard this. This is really what looks like the best swab to look at first, or, you know, how you would prioritize. And it was just so interesting to see how much of this was different when they began to use machine learning. So I'm really curious to see how those systems develop to be able to assist the lab to say, hey, you know, your expert has read all of these things, and every indication from what you're reading in the story of this says go this way, or the saying said go this way. But experience has told us with all of these pieces of information, there may be a better prioritization to go with this. And I say all of that with their conclusion in that paper was, still, go ahead and test all, because the societal gains are enormous. They would be higher if you hit properly from this prioritization, but go ahead and get them all in there. And then that still comes back to the resource allocation, that this would be greatly efficient for this, but without the budgets to support this, then something else is being delayed. So if there was more of an understanding of what these societal gains were to the funding bodies, that the legislative bodies, whatever they might be, whatever your jurisdiction is, had a greater understanding of how well the community does by allocating more resources, that would be ideal. But without that ideal, I really like the work that they did out of Stanford on this to say, okay, well, in the interim, here's a great way to be able to prioritize what goes through, and to also take a look at how much have you stolen from other areas of the lab. And, I know I went too quickly through this as I was paying attention to time, but what we've been doing in recent years is the allocations are not meeting up with the demand for services, and everything is being delayed. And so it's, if we prioritize this, something else is being hurt by this. And those are decisions that really need to be on the table with that, you know, to say, okay, are you conscious of the choices that you're making, that this is delaying this? And I don't have a good answer other than to provide more money.
And Paul, you're queuing up those decisions. Labs are in a position to make those decisions based on data now, which is the premise of this whole meeting. Is now we are partnering with researchers so that the data is available to make some of those decisions, to make informed decisions. And there's some questions in the chat pod. The study you're referring to is the Wang and Wien study out of Stanford. Is that correct?
Yeah, the more recent one where they work with the folks at the San Francisco lab.
And Julie, I know your work is in this area. You want to weigh in on this one?
All right, suddenly went off. Yeah, so I think I uploaded that for some. We just need more data on this, right? We think these initial findings are, and my findings are, the more swabs we test, the more likely we are to develop a CODIS eligible profile. So that's one of the main questions that we were looking at in our research study. You know, we do have these findings out of San Francisco, which are very meaningful, but we need to look at that same question in other labs, in other settings, to really discern how meaningful is this, and where do we go with this to establish evidence-based practice?
There's a lot of questions coming in the chat about how do we not bias the scientists. We had some discussion about this yesterday as well. What are your thoughts there, Dr. Valentine?
Well, I think really the scientists are a group that we've neglected in a lot of ways. And what I mean by that is they often are reading these reports, and we don't think oftentimes about the vicarious trauma that these forensic scientists have as well. I think that's something else to acknowledge. I do not feel, as a forensic nurse, that I am biased. My patients are most of the time victims, but my patients are suspects that I get called to do DNA, and I'm going to treat each one of them respectfully and as I would any patient. I think the forensic analysts have the same approach. I think that giving people more data does not bias people. I actually think it helps them develop a greater perspective and find more meaning out of that information and data. Does that make sense?
It makes a lot of sense. And I think that's a discussion we need to have in this country, is how much information is biasing, what is biasing, and what is helpful information to lead to the investigation. And grateful for your research in that area, helping us foster that discussion. I do want to transfer topics here a little bit, kind of along the same lines, and maybe transfer to Dr. Bostaff. There's a question about the data on serial rapists, and certainly we're seeing different data come out of different areas of the country. Maybe there's a national statistic, maybe there's not, maybe it's a regional statistic. What are we seeing as it relates to serial offenders? Do you have thoughts on that?
So a couple things. I don't think that what I don't want to have happen in the research realm is that we start creating some sort of hierarchy about what areas are most important to research, because I think we can learn so much from both the untested backlogged kits and testing moving forward. But I think we also have to be clear that oftentimes we are looking at different things when we look at those different populations. And so one of the questions that I hear more researchers asking, at least in the criminal justice area, is that the information regarding the serial nature of many people who engage in sexual violence, a lot of that research came out of those backlogged cases. And a lot of that research has been done on 1 or 2 locations in the country. And those results have really provided the foundation for that. What we need is more research across multiple locations, and not just in backlogged cases, but in cases moving forward, before I feel like we really can substantiate whether that serial nature of so many rapists is actually the case. And so I have heard more researchers, probably in the last, well, the pandemic has screwed up my time frame, but maybe in the last like 3 years, start to ask, is this really what we know, or is it what we know from a specific population in specific locations across the country?
I love that answer.
Lisa, I've got a great question and a follow-up with that, because Rebecca's not here, but she's posed in her research some really interesting things about this. Is that the fact that too many cases, the kits that did not go forward were somebody that was familiar to the person who made the claim, and so we don't really know in that case how much these are repeat offenders. Have you seen much of anything on that? Because that missing statistical data I always found is one of the really interesting things. It would be really great to know moving forward.
Yeah, and I haven't seen a lot. Dr. Campbell's research is groundbreaking and foundational in this area, as is the research by Dr. Cassia Spahn out of Arizona State University, particularly in prosecutorial decision-making when it comes to sexual assault cases. And once again, I think we have so much we can learn from these large data sets. I mean, obviously having very large data sets allows us to do so many other things than when we're restricted in our sample sizes. But one thing that I have been getting a little more concerned about is when we are basing recommendations on policy and practice, particularly in the area of policing, from research that's being done on data that is a decade or more older. Because we have to start questioning whether what happened in cases a decade or more ago is really reflective of what's happening now in policing agencies around the country in terms of investigation, especially given how, thankfully, how much in demand Dr. Campbell has been to do trainings on the neurobiological effects of trauma for policing professionals to understand. And so we have seen changes in training and changes in police protocols. And so if we're only going to make decisions based on data that was collected 10 years ago, then we're not being really reflective of those changes. And then I start having some concerns about recommendations coming out of the findings of data in that. So I really think we really need labs, and we really need policing agencies to be open to working with researchers in a partnership manner to look at more recent data and more recent investigations in order to have a better idea of what's happening now.
If we could summarize the entire symposium, Dr. Bostaff, you've just given it to us. So many thoughts rolling through my head here. I think we have to have a mechanism to feed back in the research, the current research, back into the practice in the laboratories. And it is exactly that. It's labs and others, law enforcement, being willing to share these data sets in a way that's meaningful to the researchers. I appreciate your comments there. Let's go for just a second. I want to go back to Bruce and have a quick conversation. They're talking about this concept of you're collecting data, you're providing data to researchers. How much are you having to modify the forms, whether it's the forms that the nurses are collecting or other forms, other data sets, stuff your analysts are collecting to be able to participate in the research? And how are we successful at that?
Well, we were fortunate that the state did a good job on designing the form. So we, other than just input that we provided with other jurisdictions, we didn't really have to do any of that hard work. And they did it correctly. And I didn't know that when we started our project. It turned out they did. I was very happy that getting the information out of those forms was easy. As Matthew knows, we like to do data systems ourselves, because it's very direct. And when you can do that, you can provide the solutions to many different stakeholders well. But there are a lot of other jurisdictions, especially in Southern California, that are looking about how to do this. So I think number one, you want to adopt standards, right? You don't want to be the only person doing something. And it's not really difficult to do. So the encryption can be standardized. How the data is pulled out can be standardized. LIMS systems all have interfaces in and out now. Most DAs and prosecutors have standard databases and electronic systems. Law enforcement agencies are almost there. So the infrastructure that's needed is really there. We really don't have to jump through hoops to get it. It's all about developing the languages and protocols and the agreements for us to do this, and then finding people that actually will do the programming work. I don't think it's that difficult because almost every government and law enforcement agency is already doing this to some capacity. The standards don't have to be developed. Everybody knows what they are. Best practices are there. It's really just the details. Someone has to be willing to dedicate the staff time to say, I get this from this person, I put it over here, I ship it here, I integrate it on my list this way, and this is how I get it to the prosecutors. It's just, we develop websites that do reports. We publish our quality manuals on website. It just is that kind of details. You just have to have people willing to do it.
Dr. Valentine, let's go to you on that same question. As you're collecting and as you're coding the data, are you finding that labs and nurses and others have this data? Are you having to ask them to collect additional data? Well, what are the problem points there?
The problem points are that it's different everywhere. We don't have a standardized national kit. We have national guidelines for the examination forms and for the kits, but I've been to some places recently where they're still doing slides that I don't, the smears and the slides. For those of you that remember, we used to, when we do an examination, the nurses would actually make like glass slides and smears, and that really has been outdated for a long time. So it's trying to go to the next level of really getting this evidence-based practice, but also just trying nationally to catch up so everybody is where we have current best practice recommendations and getting on the same page on our definitions. I talked about some of the challenges with CODIS entry and interpretation of FBI on what goes into CODIS and what doesn't. There's a lot to discuss, and having some definitions that are clear will certainly help as we move forward. Not only help, we have to go there because I think if we don't go there, then it's really hard to make meaning that we can apply to other settings if we're all talking about different terms and all at different levels. So education and that collaboration is key.
Isn't there enough inertia though from the number of states that have actually standardized that most of the other states can just adopt what other states have done?
I absolutely think so. And you would think this would be easier. We've got I think we've got really good policies. The national best practices really release great information and guidelines. So I think that seems like that would be an easy thing to do. But I'm amazed at how many places I go to and I find out that the forensic examiners or the nurses never talk to anyone in the crime lab. There's no communication, right? And so I mean, the focus of this and a lot of the work at FTCOE and RTI and NIJ is increasing that interdisciplinary collaboration, and anything we can do as researchers to improve that is meaningful, but also just as those practicing in the field, we need to have those discussions.
I guess I see it. The hard work has been done. I mean, how can we do this? It's already been done, right? It's
Right.
really just a matter of getting the funding. Sure, funding and resources are critical to do this, but you're not reinventing the wheel every single time we have to do this. And so it's just a matter of getting everybody in agreement that we're going to do this so you can start implementing those things.
Right. And that goes back to, what do we value? And are these sexual assault cases valued? And I've got data on prosecution, which, we've seen the increase in the sexual assault kit submission, and then our prosecutions like this, right? So lots of work to do.
On that vein, I appreciate that this has been great dialogue. We could go for hours more and I would still be entertained and engaged. But we only have a very few minutes left. Maybe if each presenter could take 30 seconds and summarize what you want the audience to know and take home from this presentation. Bruce, can we start with you?
Sure. I would really underscore what I just told Julie, but I think we're not talking about can this be done? I mean, this can be done. It's just really a matter of facilitating it with resources and getting the details as necessary. But I would encourage you to use your labs. Your labs are hubs of information a lot more than I think even the labs realize. And so they can facilitate a lot of these dialogues because they have so many partners.
Thanks, Bruce. Julie, maybe you go next.
Mine's going to be similar to Bruce. It's get to know what the interdisciplinary partners are doing and building those connections and relationships, and having discussions about where do you go next, and looking at what's out there and what's worked in other places and how do we adopt that, such as the tracking system. There's many places that have tracking systems now. Find out what they have and what works for them, and many of them are free that you can adapt, and seek what's there, and then work with your partners and bringing them into your area.
Thanks, Julie. Paul?
Yeah, the conversation here really kind of fits in with this, is that this is a community, and everybody in this community needs to both contribute as well as extract from this. So the conversation that you just had on standardizing things, I think you just created the community need to fund Julie to be able to create that standardization. And it's much of what we saw with Foresight. It just took volunteers to say, okay, we need to have this. I will give my information towards the whole. Let's unify this in a particular place. So use what is out there and where you can really benefit. Everybody can actually get more out of it than what they put in, but it takes some incentive from the community to make these things happen and say, I'll do my little piece of it. And then you have, researchers that you've seen here today that are willing to take this, but they need the cooperation of the entire community.
I love it. Thanks, Dr. Speaker. And Dr. Bostaph, we'll give you the last word.
Well, for all the practitioners and agencies out there, I hope what you take away from today is that researchers aren't as scary as they may seem. But I'm not going to stand here and say that we're all as open to doing community-based research as everybody that you've seen here today. And so much like choosing a physician or a counselor, if the first one doesn't fit, please don't give up. Reach out to all of us here if you're looking for a recommendation of somebody in your area that may be at a university that we could maybe connect you to that would be open to working with you on these things. And if you're as a researcher, if you're a researcher out there watching this, I hope what you also remember is that working with agencies is like dating. You need to put in the time to get to know each other. That's how we build trust. And when you build trust and you demonstrate that you are trustful and you are trustworthy, then I really believe agencies are more willing to open their data to you and are more willing to work as a partnership. But we have to do as researchers, we have to put in the work to establish those relationships.
Dr. Bostaff, your comments are point on. We have found the best here at the Idaho State Police Forensic Services to work with. All of these collaborators that you've seen on the screen today and many, many more are just the best of the best. And we appreciate you in presenting today. We appreciate you making us better today. We've had a fantastic 2 days. Just to summarize, we want to thank a lot of people. We want to thank our friends at the FTCOE. Specifically, I want to call out just a few names. I want to thank Shannon Kraus, Patricia Melton, Natalie Rodriguez, Tyler Reibel, and also Lauren Mangum for all of their production assistance and help in putting this 2-day webinar together. I also want to thank our team and Dustin Leverett. We have a plaque for him here. I'll show it. Dustin has been fantastic. Dustin, drop over here on camera for just a second. All of the video that you've seen yesterday and today comes from Dustin and all of his great work. I'm going to let you drop in. There we go. We're going to present this plaque to Dustin in our grateful appreciation for all that he's done to make this webinar a great success. Thank you, Dustin. We appreciate you.
My pleasure. Thank you.
Tyler, we'll turn it back to you. Thank you so much for all of your help. Thank you to all of the attendees.